We'll now like to have Dr. DiDomenica. Sorry, Bessie, I can't say your last name. I'll let you do that for me. Bessie is a Walden alumna and is also a social change fellow with the Center for Social Change. So we're really, really pleased to have you with us to talk about your research on food scarcity.
Thank you, Sean, and thank you for inviting me here today. It's Bessie DiDomenica, yes, and I'm a PhD in public policy. And some of my specialties include policy analysis and also, sustainable communities. So I've done a lot of research on the food policy area. I did my dissertation on urban agriculture and urban farming. I also designed and presented webinars on water, land, and our global food system. And most importantly, right now I'm doing a research project funded through this grant on food policy and older adults in rural communities. So I'm really excited about this conference today because it makes a nice segue into a lot of the research topics that I've touched on. So again, thank you everyone for being here today. My topic is about a snapshot of urban and rural America. Primarily, some of the biggest problems we have are with food-related or non-communicable diseases. Now, the biggest problem is, in terms of our health care, is our food choices. What we eat, how much we eat, how often we eat. In the USA today, more than 50% of all adults have some kind of non-communicable disease. And that includes diabetes, high blood pressure, heart disease, cancer, obesity, and being overweight. Another challenge is, as we heard before, population changes, cities versus rural. Populations in the cities are growing. They're younger, they have different types of demands versus communities in rural areas where the populations are also growing, but they're also aging faster. Some of the other challenges include the formal and informal social networks. Now, these are resources in a community to help provide all the necessary infrastructures that a community would necessarily need. For example, trained professionals such as visiting nurses, home health care aides, and personal care aides have more formal training than someone, for example, who is an informal caregiver in a rural community. These people are family, friends, neighbors. These are the people that are caring for more of the older populations in rural America. And other challenges include different types of food safety nets. For example, in the city, there are food banks, more food pantries, and of course the SNAP programs. But in rural communities, people rely more on food as a barter system. So they will do work on a farm, do some work for a friend in exchange for food. This is a totally different type of informal food structure that people are engaging in order to survive. So some of the basic takeaways include problems with food education. Now, food education is, well, how much do you know about food? I've discovered that people have trouble distinguishing between healthy and unhealthy food. Part of the confusion is around, of course, food cultures, food traditions. Some of the marketing you see on televisions drive the types of food that they're trying to force us to eat. So bad eating habits result in more non-communicable diseases. In addition, food systems are more complex. Today's food system is very complex. It's very large. A lot of it relies on food that is processed with chemicals, pesticides, hormones, etc., versus a more simpler type of growing food system called organic. There are no pesticides involved, it's low volume, and it's much better on your human system overall. Of course, land is a factor in all these food systems as well. And again, population shifts. As we've heard, cities are becoming more populated, rural communities are becoming depopulated, just the opposite direction. Some of the systemic causes of food scarcity include rising healthcare costs. Again, totally all related to our eating habits, non-communicable diseases. More bad diets means more non-communicable diseases, which causes more higher healthcare costs in children, youth, adults, and older people as well. And conflicts in public policy. Public policies are really about trade-offs. You can't satisfy everyone. So, for example, cities have limited land, but people are trying to be more creative in how they're growing their food. versus rural communities have much land, but that's a problem with who controls the land, big agriculture or small family farms. And finally, poverty and the quality of life. This all relates to the type of resources in a community. As I mentioned, in cities, there's more public assistance, easier access to food pantries, etc., SNAP programs. But in rural communities, it's more informal. People rely more on their neighbors. They're trying to barter more for food. And so the basic action steps for food scarcity in the U.S. is basically, let's try to eat fresher foods every day. It's a problem with trying to remind people to change their eating habits throughout their lives. Because let's face it, you can't eat the same food you ate as a teenager as an older adult. Secondly, try to grow your own food to help supplement the food systems for tomorrow. It gives you an opportunity to connect with your food sources, understand where food comes from. And in reality, anyone can grow food at home. You can grow spices, herbs, tomatoes are very popular. Start with trying to cook meals with fresh foods. Visit your farmer and meet the animals and find out who grows your food and where it comes from. The bottom line for this is really action steps to try to create a different food culture around fresh foods and healthy eating habits. Thank you very much.
Thank you. So we still have a couple minutes. I want to ask a question to you right now, and have maybe Chris think about this as well, because I'm going to scale up the question in two parts, and the first part we can, I think, deal with right now. And that is this notion of how do we come to grips with agriculture at scale, the ability to feed a really rapidly growing population worldwide, even though there's some stabilized populations in the western part of the world. Worldwide, agriculture's gone big and has gone at scale because they need to reduce those costs in order to make the food affordable. Something I've thought about is when I lived in Connecticut, they passed laws that basically made it very difficult for you to grow your own food in your backyard, right? So there's that trend for government to regulate because they're afraid you're going to grow food that'll kill you. How do you cope with this sort of mixed signals of the need for scale and the resource intensity and even a hostile legal environment towards trying to do it on your own?
Well, this is a very interesting question because the bottom line is, as I said, people could do simple things like grow food in their houses. Just put something in a pot, grow it in a container. You don't necessarily have to use real estate to grow your own food. The second part is that there are lots of community gardens, community farms. And this is the kind of food that people grow for themselves individually. Communities can have public land to grow food and then share it with neighbors within their community. So there are possibilities. It's difficult, but it's definitely doable. Thank you.
Thank you. Very interesting. Well, I think, Chris, I'm going to